Hello everyone, how have you been? Welcome again to my YouTube channel. If you are new here, you are welcome. My name is Dami Oyetola. I'm a Christian and I'm a medical doctor. I film about faith, medicine and lifestyle. In today's video, like you can see, I'll be talking about the Osce aspect of the Mdcn exam. I know someone is wondering, so why is she focusing on Osce? Why is she not focusing on MCQ? I'm going to tell you why. But before I continue in this video, I want to implore you to please watch this video to the end. Please like, share, subscribe with your friends and family. Leave your comments in the comment section. If you have any questions, please don't hesitate to ask. I will answer them for you. Okay, so let's begin the video now. If anybody is confused as to what Osce is, Osce simply means Objective Structured Clinical Examinations. And if you are a foreign trained medical student, that means you have to come to Nigeria to write your Mdcn exam in order to be able to get your license to practice in the country. Now, the Mdcn exam is divided into two different sections. The part one is the exam you write on your first day, that's the MCQ. And then part two is the Osce, where you go to the teaching hospital to do that. So I'm focusing on Osce because you are very sure that these are the areas where they will bring out the questions. It's either clerking, counseling, level of prevention, interpretation of data, identifying instruments and things like that. So like physical examination, very important. So you are very sure that this is where they will bring the question from, so you know where to concentrate. Even though you are not sure, maybe they will bring out cardiovascular examination or respiratory exam, but you just know that at least this is going to come out. But like MCQ, where you have to read a lot of things and you're not even sure maybe they will bring it out or not, and you might end up doing guesswork to answer the questions. Okay, so I know somebody's already anxious, like 5 minutes, like how will I be able to clerk, counsel, do physical examination, level of prevention in 5 minutes? But I'll tell you what, you can do it. Many people have done it. I have done it, and you can do it too. You just need to prepare. They said constant practice or constant repetition strengthens memory. So the more you practice, the more you're able to beat the time record. Me, when I was preparing for my exam, I practiced with my friends and we used to time ourselves 3 minutes, 4 minutes. So on the exam day, I didn't even spend up to 5 minutes per station. I had stations where I finished even before they rung the bell. Okay, so let's dive in. So I'm just going to walk you through your clerking, how to do counseling in Nigeria, physical examination and level of prevention. So let's start. For clerking, there are 5 C's of clerking. So you do your chief complaint, the course, that's COURSE, then the course of the chief complaint, CAUSE, then you go to complications, then you go to care received. So for example, they give you a symptom like you have a patient that comes in with cough and night sweat in Nigeria. Don't think too far. You already know that this patient has tuberculosis. So let's begin. At the beginning and end of every station, be sure to greet your examiner and your patient. That is very important. So you go to your station, you're standing at your patient's right side. Please don't forget, if you stand at the left, you might lose your mark. So you say, "Good morning, ma. Good morning, sir. How are you doing today? My name is this," and please don't introduce yourself as a doctor. This is because you've not even gotten the license to work in the country. Just say your name and your exam number. "My name is this. I'm a candidate of this exam, and for the purpose of this examination, sir, I've been asked to take a focused history of your symptoms. Please, may I proceed?" Now that is asking for consent. If you don't ask for consent, everything you do after that might not be marked. So after asking for consent, now you want to know your patient's name, you want to know their age, you want to know their tribe, you want to know their religious group, you want to know their address, you want to know their highest level of education attained. So after that, now you now ask, "Please, sir, why are you here?" So your patient says, "Oh, sir, I have cough and night sweat." So the patient has 2 symptoms now. So you ask, "Okay, sir, which one started first?" He's going to say maybe the cough or night sweat. So you clerk the first symptom first. So let's assume the cough was the first that started. So you start. When did the cough begin? So this is the course. How long ago have you had it? Did it start suddenly or gradually? Has it been continuous or intermittent? Has it gotten better, worse, or remained the same? Is it a barking cough? Is it a whooping cough? Is it productive of sputum or not? If it's productive of sputum, you want to know the color of the sputum, you want to know the quantity, you want to know if it has any foul-smelling odor. You also want to know if the cough is stained with blood, and that's all for the cough. Then you go for your night sweat, the same thing. When did it begin? How long ago have you had it? Did it start suddenly or gradually? Has it been continuous or intermittent? Has it gotten better, worse, or remained the same? Is it the particular time of the night where you sweat more? Do you have to change your pillow frequently? How many times you have to change your bedsheet or pillow at night? And things like that. So now we are going to the causes. So what are the things that will expose somebody to TB? Number one, you want to ask, sir or ma, did you get your dose of your Bacillus calmette-guerin vaccinations as a child? Do you know? You want to know if the patient lives in an overcrowded area, or if the person was just recently released from prison, because you know that place is overcrowded. You want to know if the patient is immunosuppressed. So you ask things like, sir, do you know HIV status? Have you been using steroids chronically? Sir, do you have diabetes? Sir, have you experienced any form of weight loss recently? Then you want to know if the patient consumes alcohol, if they smoke. Also, you want to know if your patient consumes pasteurized milk. But in your exam, you're not just going to say, sir, do you consume unpasteurized milk? You have to ask, sir, have you been consuming milk directly from cow without boiling it? And that's the end of our course. Though there are other things you could ask, but I can't remember them right now. So after your course, and you want to know complications. So what are the complications of tuberculosis? It can cause Pott's disease. It can cause infertility. It can also cause TB of the stomach. So you want to ask your patients for Pott's disease, sir, have you been having any back pain, any form of muscle weakness? For TB of the abdomen, you want to ask if they have had any abdominal distension, any change in bowel habits. For genital TB, you want to ask if the patient is currently having issues with infertility, erectile dysfunction. It can also affect the kidney too, so you can ask them if they've been having increased frequency of urination, if they've been having pain on urination, if they've noticed that their urine is looking frothy. And that's all for complications. Now for care received, just think of what are the things you normally do for your patient. If you're a doctor and your patient walks into the hospital with TB, so you want to ask your patient, very important in Nigeria, sir, before coming to the hospital, have you gone to any religious home? Have you gone to any herbalist? Because Nigerians, they will firstly go to different places, and when things become worse, they will now bring themselves to the hospital. So you want to know if they have had any herbal concussion. Then have you visited any hospital prior to coming here? Have they done any tests for you? Did they ask you to do any chest x-ray? Were you asked to do any acid fast bacilli smear? Were you to do a tuberculin skin test? Now you want to ask them, were you giving any medication to treat this condition? Were you giving rifampicin, isoniazid, pyrazinamide, ethambutol, or streptomycin? Was it given under directly observed therapy, and how long did you take them? And that's all for your care received. So now you go to the next things, which are your drug history, your past medical history, past social history. You want to know your patient's family history. You want to know their social history, and the most important thing, your review of systems. And when you're doing your review of systems, you have to start from head to toe, so that your examiner will know that you're smart. You don't just do things haphazardly. So you start from CNS, and then you go to cardiovascular, your respiratory system, abdominal system, genitourinary, musculoskeletal, and hematology system. So you could ask, sir, have you had any headache, any dizziness? Have you had any chest pain? Do you have to wake up at night to catch your breath? Have you had any cough, any catarrh, any runny nose? Have you had any abdominal pain, any nausea, vomiting, diarrhea, constipation? Have you noticed any change in the color of your urine, any urinary frequency? Do you feel pain when you're urinating? When you finish urinating, do you feel like you've not finished urinating? Do you soil your pants after urinating? Then you want to ask if you've had any muscle pain, any bone pain, joint stiffness. You want to know if they've had any easy bruising, or maybe when their wound does not heal on time, or when they are bleeding, they bleed for a long period of time. And that's all. Then you say, thank you, sir, thank you, ma. So for example, if you have a gynecological patient, the only difference will be that before your chief complaint, you ask the patient for their reproductive profile. And what is reproductive profile? You want to know, ma, how many times have you been pregnant? That's gravidity. Then you want to know parity. Ma, how many children have you carried beyond 28 weeks? Because 28 weeks is the age of viability in Nigeria. And you want to know the first day of their last menstrual period. Then you want to know their confinement history. That's when you ask, ma, when was the last time you were admitted at the hospital? And that's all. And then you do your gynecological history first, if your patient is a gynecological patient, then OB history. But if your patient is an OB patient, then you do your obstetric history first before your gynecological. Okay, so the difference for pediatrics is after you do your 5 C's, then your drug history, then you want to know the prenatal history. You want to know if the baby was carried to term, if there are any complications while the woman was pregnant. Then you want to know natal history, and you're going to ask, ma, were there any complications during labor? How long was the labor? Then you want to know placental history. Ma, did your baby cry immediately after delivery? How long did you stay at the hospital for after you gave it to your baby? And you're going to do your nutritional history. You want to know how frequently the child eats in a day. You want to know the adequacy of the food. You want to know the carbohydrate, the fats, protein, content of the food. Then you want to know if after the child has eaten, the mother has noticed any weight gain or weight loss. That's utilization of the nutrients. Then you want to go to developmental milestones too. So you're going to ask, ma, when did your child gain head control? You want to know when the child started crawling. You want to know when the child could sit with and without support, when the child started standing with and without support too. And then you ask for your immunization history. You can just ask, ma, has this child received all the necessary immunization for the age? And then you ask your social history too. Social history in pediatrics is a little bit different. You want to know how many children are in the house. You want to know how the child behaves both at home and in school. You also want to know if there's anybody that smokes and drinks around the house, because now if someone smokes, the child can become a second-hand smoker, or the child can even steal whatever the person is smoking and start smoking it. You also want to know if someone drinks around the house, so that the child not just can start drinking something when the parents or the caregivers are not available. Okay, so that's all for clerking. Then we'll move on to counseling. There's a mnemonic for counseling. It's called gather. So your G is for greeting, A is for asking, in T you tell, in H you help, and then E is empathy, then R is retell. So greet as usual, greet your patient and examiner, and then you help the patient to know that you are going to be confidential, because now they are telling you things, and if they don't know that it's just going to be between both of you, they may actually be hesitant to tell you. So you tell them that I promise you that everything you discuss with me today will solely be between you and I. Then you ask for your consent to proceed. Please, may I proceed? Then so you want to empathize with the patient. Sir, I understand that maybe your patient has colon cancer. So I understand that you have colon cancer, but I want to assure you that I'm going to do everything within my power to help you. Sir, it's not the end of the world. I hope that you get better soon as we begin to commence our treatment. So now you want to define colon cancer. You want to tell the patient the risk factors. You want to tell the patient the causes. You want to tell the patient the symptoms of colon cancer. And then you want to tell your patient the investigation. You want to tell the patient the complication. Then after that, you go into the things you're going to use to diagnose colon cancer. Or we are going to do CT scan. We're going to do your barium enema. And you tell your patient the treatment available. All along, you're going to be showing empathy and, trying to put yourself in the patient's position and just help them to feel better. Then after that, you are now going to ask the patient, sir, do you understand everything I have told you? In your own words, can you kindly retell everything I have told you? That's to ensure that they were going along with you and that they understand everything that you have told them. And then you tell them that, okay, sir, please don't forget to come back for your next appointment, maybe in the next 2 weeks, next 1 week, next 3 weeks. And that's also you greet your patients, you greet your examiner, and that is all. So now the next thing we'll be doing is physical examination. So in this video, I will not be able to show you how to do physical examination because firstly, there are a lot of them and there's nobody to practice on in this video to show you, but I'll just tell you the basic things that you need to know. Okay, so firstly, for your physical examination in Nigeria, there is a different approach to that. So when you get there, as usual, you greet and introduce yourself. Then after that, you turn to your examiner and say, sir or ma, I would like to screen this place for my patient's privacy, and then I would like to adequately expose my patient. For instance, if you are doing an abdominal examination, you want to expose your patient from the chest to the mid-thigh. After your exposure comes the positioning, and as you are telling your examiner that you want to expose your patient, you turn to the patient and you say, sir, can you remove your shirt? Can you pull down your trouser to below your waist level? Then after that, you want to tell your examiner, I would like to position my patient. So you tell your patient, sir, can you lie down with your back to the bed, your hands together, your palms facing forward, your legs together? And then you tell your examiner, sir, I will need a chaperone for my patient. Then the next thing, you want to wash your hand before you begin your examination. I want to implore you, if you've not yet started your examination, please don't touch the patient, because once you touch, that means you've started your examination. And then be sure to stand on your patient's right side, because once you cross over to the left, that is the end of that examination. You might not get your mark. So now you begin your examination by inspecting from the head of the bed to the tail of the bed, and then be sure to focus your attention on the abdomen. You know what are you checking for your inspection? You want to check for scars. You want to check for the shape of the abdomen, if it's scaphoid or obese. You want to check if it moves with respiration. And then after your inspection, then you want to check for cough impulse. So you tell your patient to turn their neck to the side that is not facing your examiner, so they don't cough on your examiner. And then you ask the patient to cough while you place your attention on the abdomen, check for cough impulse. And after that, you begin your examination. So you do your palpation, your light palpation while focusing your attention on the patient's face, because now you're checking for pain. And then you do your deep palpation till you're feeling for masses. After your palpation is where you want to do your percussion, and then after percussion you're going to do your auscultation. And then to end your abdominal examination, you're going to end with doing a digital rectal examination. So now you tell your examiner, sir or ma, I would like to end this examination by doing a digital rectal examination for my patient. Normally they might tell you to skip and they might tell you to continue. So when you tell you to continue, don't get perplexed. So you say, okay, I would like to place my patient in the same position. You actually need to know how to place your patient in that position. So you tell your patient how to lie down. So if your examiner tells you to proceed, don't be afraid. Just say, I would like to wash my hand, and that will be. So the next thing which I found strange was level of prevention, because I wasn't taught that in medical school. But don't be afraid, I'll just walk you through it. So there are 5 levels of prevention. So levels of prevention, you're just, you are trying to manage a disease. You don't want it to go to the complication. Like, in Nigeria we have diseases that are endemic and we have epidemics in Nigeria too. So when you are doing a level of prevention, you firstly list the level of prevention before you begin explaining. So in this station there's no patient, it's just you and your examiner. So you greet your examiner, good morning sir, my name is this, I've been asked to tell you the levels of prevention of, let's say, measles. So sir, there are 5 levels of prevention and you list them. Level 1 is general health education and promotion. Level 2 is your specific prophylaxis. Level 3 is early diagnosis and treatment. Level 4 is where you limit disability, and level 5 is your rehabilitation. I'm going to say, sir, level 1 is general health education and promotion. So I'm going to educate the public through the use of social media. I'm going to go to radio stations, television stations. I'm going to go to marketplaces. I'm going to go to schools. I'm going to host seminars and tell people about measles. That measles is a virus of the paramyxovirus family, but it is caused by rubella virus and it can be transmitted by respiratory droplets. And then you tell them that, okay, that people should cough on their sleeves, don't cough on your palm. And then for your level 2, which is specific prophylaxis, you want to encourage people to get their measles, mumps, rubella vaccine. Also, you want to isolate sick individuals, and that will be all. And then for your level 3, which is early diagnosis and treatment, so you want to screen people that have running nose, children that have cough, children that have coryza and rising temperature. You want to screen them with your viral antigen count. You can also do your routine blood tests like your full blood count, electrolytes, urine creatinine level. And then for your diagnosis, you're going to diagnose measles with your viral antigen test. And then for treatment, so you're going to say that, okay, I'm going to give my patients calamine lotion to rub on their body. I'm going to give them intravenous to prevent dehydration. I'm going to give them antibiotics. So now you want to limit disability. You want to give your patient vitamin A to prevent blindness. And then for rehabilitation, you want to give your patient a letter to go back to school. You want to give social support. And that will be how you thank your examiner. So this brings us to the end of this video. I hope you learned a thing or two. And if you are preparing for this exam, I want to implore you, don't be afraid. Just study hard, pray. For me, when I was preparing for my exam, I used to study with my friends. That really helped me. I pray that you run this exam once and you pass in flying colors in Jesus' name. Until next time, stay safe and remain blessed. Thanks for watching. Bye bye.